Hi, everybody. Welcome to the podcast series on innovative healthcare solutions, sponsored by the Conference of Consulting Actuaries. Now, as a reminder, these podcasts are a series of interviews with actuaries and other professionals really focused on delivering innovation in healthcare. These sessions are offered to provide insights about what's transpiring in our ever-changing healthcare environment that we live in. Again, I'm Ed Pudlowski. I'm president of Morningstar Actuarial Consulting, and I'm also chair of the healthcare community within the Conference of Consulting Actuaries. And I'm going to be your host for today's discussion. Now, I'm really delighted to be joined today by Steve Bonner. Steve is CEO of SkinIO. And maybe before we talk about that a little bit, I'd just like to thank Steve for joining us today.
Thank you, Ed. I'm excited to have a chance to share a little bit about what we're doing and see how it might be helpful to you and your audience.
Excellent. Now, Steve, SkinIO offers early skin cancer detection capabilities, but really this isn't your first venture into the field of cancer and cancer treatments. Can you offer, some background on yourself for our audience?
Sure. So I guess my earliest and deepest involvement in cancer detection and care was as the CEO of a company called Cancer Treatment Centers of America, which I joined in 1999 when it was a mid-level startup. And I served for 15 years and really transformed late-stage cancer care, both by a direct-to-consumer model, which was unheard of in the hospital environment at the time, but also by pioneering and really maturing a holistic and fully integrated array of services for patients with late-stage complex cancer. So the traditional therapies, but then a host of other things that help to support the immune system, and wound up creating a very well-respected and widely known approach to treating cancer. I served there for 15 years, which I agreed to do, and then left and have now transformed my professional life into a little bit of teaching of healthcare innovation at the Harvard Business School with Professor Regina Hertzlinger. But more than that, as an investor, advisor, board member, mentor for healthcare startups. And I have a portfolio of 25 companies where I serve in those capacities and functions. The newest one is SkinIO, which is what we want to spend a little time talking about now.
Yeah, so it seems like your background is perfectly fit for this startup, so that's exciting. So I kind of tease the audience that SkinIO is all about early detection of skin cancer. What can you, obviously without giving away trade secrets, what can you offer about the technology that's, behind SkinIO? Just help our audience kind of understand, what it does.
Sure. Well, the big objective and the huge success in skin cancer, winning the battle against skin cancer, is early detection and early access to the care that patients need. And that's what we've designed into the technology that comprises SkinIO. Our technology is comprised of two major components. One is a downloadable app that can go onto an Android or onto an iPhone or onto an iPad. And it allows us to remotely conduct a full body skin analysis using this technology to then load into our other major technology component, which is an AI supported database that analyzes the scans that we capture from the patient, highlights every single outlier on the skin of the patient physically. I mean, with a little red circle on the scan of the patient's body that says this is something that looks like it might be cancerous and it needs to be seen by a dermatologist as quickly as possible. So the downloadable app really looks like a facial recognition kind of software. And we capture 11 to 13 images of different parts of the patient's body. So start with head and neck, you get a white outline around head and neck, and then you position your head and neck, and the AI guides you. You need to be closer, you need to be farther away, we need more light, less light. And once it has an analyzable image, then the white outline goes green, it captures the image, and that goes up to our database, and it guides you to capture the full body. And what it's looking for are, against our algorithms, outliers from normal skin appearance. And this is very effective and proven across all of the skin colors and skin types. It creates, we think, a great advantage for the dermatologist, as opposed to the old way, which is a visual observation of the skin, where, especially if a patient's covered with a lot of moles and a lot of freckles and so forth, and also very early presence of skin cancer, the visual observation may not give you the full analysis that we give. And so images captured, analyzed, then we have them reviewed by a dermatologist before we go out, and then we go out to the patient or the clinician who has conducted the scans and say, this patient presents one of three ways. Number one, there's no observable risk of skin cancer. There's no need for them to go to see a dermatologist, to consume bandwidth and clinic time in a dermatology clinic. We've got the scans now for this patient in our database, and that's a basis for us to continue to scan over time and look for changes, which make this even more effective as a skin cancer risk assessment tool. The second group are people where we say we see some anomaly in the skin. We're not sure that it is skin cancer, but it's something that should be seen by a dermatologist in clinic to find out what it is and to take appropriate action. And then roughly 20% of our scans, we say there's something here that definitely needs to be seen by a dermatologist as quickly as they possibly can be seen. And we're working then, as we're building a network of dermatologists to then receive our patients. And the major commitment that the network dermatologists make is they'll see our patients within 2 weeks. And then we're looking to get the clinic results to feed back into our system. We thought we saw something, what was concluded in the clinic, and how do we continue to improve the quality of our AI and our analytics based upon the clinical reality. We're also trying to get a therapeutic design and results and cost back into the system and outcomes, so that we can continue to build a database that both improves detection and access to care, but also proves the economic value of that, which is one of the, as you know, Ed, one of the most important parts of our interaction with the actuarial community and with you in trying to really nail the power, the economic power and the human power of this kind of early detection connection to early care.
So Steve, first of all, that's fantastic. Just to kind of, it's exciting to hear about how AI is being used in all kind of fields. But this is obviously something that can truly bring some real value to people. But maybe talk a little bit about kind of what was the gap in the diagnosis or the delivery of skin cancer treatment that really resulted in this app having a broad application.
I think the science is clear, and I'm guessing your audience knows that the condition of skin cancer is eminently curable, and eminently curable at a very low cost, as long as you find it early. And early detection, early care is almost a non-event from a cost and from a life disruption and from a cancer point of view. The challenge is that dermatologists are so busy seeing all kinds of patients with all kinds of needs. The number of dermatologists isn't growing, but people are living longer and they're much more attuned to the appearance of their skin and the care of their skin and so forth. And so typically if you call a dermatology office as a new patient and ask for an appointment, it's going to be 3 to 6 months before they can see you. And there are some parts of the country. We did a study in one of my Harvard classes. A team went out and tried to find dermatology appointments in the Boston area, and they couldn't find a clinic that was accepting new patients.
Wow.
And so you have this tension between skin cancer, a need for early detection, early care, and a huge challenge to get access to the community. So that's the essence of it. And what we think we offer is a win-win-win for the patients and for the dermatologists and for the employers and for the payers, because we can do that initial analysis, and we can find that 50% of the people who would otherwise want an appointment with a dermatologist to find out if they're at risk, they don't need to go to a dermatologist. We can do that for them using this app. Also, we're kind of building that frequent flyer online equivalent for patients with skin cancer. Instead of them just going into the end of the line, we take them in and say, this is a patient who we've scanned, who has statistical likelihood of cancer treatment needs today, and ask you to get them into the queue quickly. Because if somebody has a melanoma and they wait 6 months to get it seen, that can be life-threatening, life-changing, and it becomes enormously expensive. If you can find a melanoma at stage 0, stage 1, up to $3,000, you get a curative experience and you're off. You got to monitor and keep looking, but you're off and running. If you find that same melanoma at stage 4, it's going to be anywhere from $200,000 to $800,000 to treat it. You're going to lose a lot of time at work. You're going to have a stressful patient, and their length of life likelihood is deteriorating, as well as their quality of life. And so what we offer is the chance to do that early analysis without having to distract the dermatologist. And then we bring the patients who need it into the dermatology clinic and get them a position in the clinic that really reflects the risk that they have in their life compared to all the other patients who are looking for dermatology time.
So you really talked about, you called it kind of win-win-win. Obviously win for the patient because they're getting early detection and can potentially stave off a disastrous condition that they may have. You're really assisting the dermatologist and the provider community in facilitating their ability to diagnose. You're obviously not taking them out of the equation in any way. That's not what your app does, but it does give them ability to perhaps refine their diagnosis a bit. So the other win has got to be, you talked about the reduced cost of this, the benefit of early detection, kind of getting those cancers early means that the cost of treatment is significantly less. So who's benefiting from that? What are the entities with whom you contract for services?
Sure. And before we go by it, let me be clear, we're not diagnosing anything. That's all done in the clinic. So to your point, we're not taking anything away from the dermatologist. We're enriching where they start in the conversation. And if they have our scans, which they do, and the pinpointed areas of concern, they have a much more precise and rapidly launching diagnostic experience with the patient. So that's the clinical role that we play. Where we're offering this is to employers and union members, and we're starting conversations with senior homes, and we'll go more broadly, but we're looking to help those entities who depend on their employees or their members or their residents for their effectiveness and well-being, and helping them first understand the challenge that lurks in their employee base. And what we find is that 85% of the population has either never seen a dermatologist or hasn't seen one in the last 2 years. And we know that around 2% of the population has skin cancer at any moment in time. So if you're an employer and you've got 100,000 employees and you know that 85,000 of them have had no opportunity to find out if they might have skin cancer, and yet 2% of them have skin cancer, and there's no way to get them into care, skin cancers are going to advance. And we've done actuarial analyses, as you know, Ed, that then predict how the cost and the life-threatening risk in this continues to increase. And so we say to an employer, if you were to invest in scanning all of your employees every year or every 18 months for the cost of a scan, an early detection, and you would never, if you did this, you would never have to see a stage 2 skin cancer again. You'd get everything taken care of. The economic value of that is overwhelming compared to the cost of investing in the scan.
I would also assume, Steve, that there's a kind of a health equity component here too. I mean, the fact that you're able to use this, right off your phone, if you wanted that, you're able to get to those communities that may not be served by, you talked about the low density of dermatologists that exist, but there's probably some communities where, they're non-existent or very far away. So it sounds like you may even have a kind of a health equity component to what you're doing.
Absolutely. I mean, 85% haven't been scanned, and of those, some significant portion lives very remotely from dermatologists. Dermatologists tend to cluster their practices in medium to large cities. And we've been talking to a chain of clinics in Texas where they say there are significant parts of the Texas population that are a 3-hour drive away from a dermatologist. And so to be able to reach them and offer them an opportunity to find out, is it worth a 3-hour drive, is a real health equity offering.
Yeah, and since I live in Texas, I know not only are they living so far away, but they're probably, in order to get there, driving in the high Texas heat and sun down here too. So,
Right.
So they may even be more of a high risk population as well. Hey, Steve, thank you for joining us. But before maybe we close up, I just wanted to see if you had any other remarks, anything that I didn't ask that you wanted to share.
The only thing I would share, Ed, is that part of our vanguard here is really helping to try to convince the payer community, the insurance companies, the self-employed self-funded employers, and the federal government of the power of this and how they should also be investing more thoughtfully in supporting the delivery of this kind of technology. The work we're doing, I mentioned trying to tie all the data back into the database, but then the actuarial analysis we've done sets the groundwork for us to be able to come to these payers and say, this is something that should get very helpful reimbursement for especially Medicare participants, Medicaid participants, but then also those across the insured population.
Well, Steve, again, thanks for sharing everything today. The technology and all that is very exciting, and this is where we like to see things going in healthcare, and the fact that SkinIO is delivering kind of in a gap in care in addition to providing efficiencies and cost savings is just tremendous. So just a reminder to our audience, for those of you who also participate in our healthcare community within the CCA, this is something that we can continue any of these discussions on that platform. If you're not a member of the CCA and you're watching this, you might want to consider joining, not only to experience the benefits of the community platforms that I mentioned, but a lot of the other informal discussions and all the other great benefits. Steve, thanks again for being here today and sharing your insights and experiences about the innovations that SkinIO is doing in healthcare. I know I thoroughly enjoyed today's discussion, and I'm sure our audience benefited from it as well.
Wonderful. Well, it's my pleasure, and obviously would love to hear back from any of your audience with questions, comments, or opportunities to help us make this even better for the world of skin cancer patients and their caregivers.
Perfect. Thank you.